Okay, y'all. So I'm introducing the next speaker. The next speaker is Dr. Sarah Rotschafer. Dr. Sarah Rotschafer earned her PhD in neuroscience from the University of California, Riverside, and joined Mercer University School of Medicine faculty in 2018. Since joining Mercer, Dr. Rotschafer received a grant from the National Institutes of Health, National Libraries of Medicine to improve autism education throughout the state of Georgia with an emphasis on rural Georgia. As part of the project, Dr. Rotschafer created an Autism Toolkit website as well as the Autism in Rural Georgia Challenges and Solutions online course for physicians and healthcare workers. Dr. Rotschafer also maintains a laboratory where she investigates sensory processing changes associated with conditions on the autism spectrum using animal modeling. Please welcome Dr. Sarah Rotschafer.
Hello, everyone. Welcome back from lunch. Hope you all enjoyed it. So as mentioned, I'm Sarah Rotschafer. I'm an associate professor now of neuroscience here at Mercer on the Savannah campus. And I'm going to talk to you a bit about something you're probably all at least a bit familiar with if you're here at this conference, which is informational barriers to diagnosis in rural Georgia. Hopefully, I'll also be able to introduce you to some tools that will be helpful to you, though. All right, so this is an autism conference. So what would we be if we didn't talk a little bit more about what autism is? So we've had other presenters already talk about this a little bit, but I'm just going to briefly go over autism as kind of a touch point for when we talk about autism in the medical informational landscape. Okay? All right, broadly speaking, what is autism? It's a developmental disability caused by neurological differences. So I'm a neuroscientist, so when we talk about something like that, we're looking at differences in the amount of dopamine, we're looking at differences in the amount of oxytocin, serotonin. We have differences in inhibitory and excitatory inputs within the cortex. We also have differences in the balance of gray matter and white matter. So a lot of different things, but one of the things that unites all those differences are changes in behavior. And those behaviors can kind of fall into a couple of different categories. Two big ones that we're looking at are differences in social communication and a tendency towards repetitive behaviors or rigid thinking. So social communication deficits, just to review since we're back from lunch, these would be differences in how autistic people relate to others. So they might have difficulty reading other people. They might not really track social cues. They may have difficulty in different social contexts. They may have difficulty with language, period. They may mispronounce words, use language in unusual ways, or be nonverbal. So social communication deficits. Next up, we have repetitive behaviors or rigid thinking. So autistic people might be very adherent to a schedule. They might get upset if their daily schedule is disrupted. They may have certain daily tasks that they do the same way every day and get upset if those are changed. They may also have a tendency to engage in repetitive behavior. That's sometimes called stimming. So these would be things like hand flapping, rocking back and forth, toe walking. They may do echolalia, where they say certain words or phrases again and again and again. All right. Also, autistic people autism has to be present, or signs of autism have to be present early in development. People do not become autistic. There aren't events that can make someone autistic. It's present early in life. Has to be severe enough to impact daily life. So we're not looking at a quirk. I think Dr. Call had talked about, people diagnosing themselves on TikTok. We're looking at more than just kind of a quirk. We're looking at things that actually do impact how someone lives. And then, of course, it can't be better described by another condition. Okay. So autism exists on a spectrum, autism spectrum disorder. And so what's that come from? Well, the spectrum, to be considered autistic, someone has to meet the diagnostic criteria of autism that we just talked about. But how they meet those criteria varies quite a lot. To kind of help conceptualize that, let's see if this pointer works. No, I think that's not going to work. To help conceptualize that, I put a little example of the social communication spectrum down at the bottom of my slides. Now, I've somewhat arbitrarily placed social communication behaviors somewhere along the spectrum, but I think it kind of makes my point well. So on one end of the spectrum, we have more severe behaviors. So these would be things that would probably be obvious to people even if they didn't really know a lot about autism. These would be things like if the person is nonverbal, if they don't respond to their name, if they ignore other people, right? So things that are kind of obvious. On the other end of the spectrum, you might have people who communicate fairly well, but in a slightly atypical way. Their affect might not really match what they say. They may have a tendency to kind of overshare, not really track those social cues, and say things that are inappropriate, right? The point being, though, the person who is nonverbal, their autism is going to look a lot different than the person who just kind of overshares a lot, right? Both of those people are autistic, though. They both meet the diagnostic criteria for social deficits. So we have kind of as one layer of understanding autism and the spectrum, we have different types of behaviors. We also have different severities of those behaviors. And different severities, levels of severity can even exist within the same person. You can have people who are really good at one thing, but really struggle with other things, which impacts the amount of support they need. Autism represents a range of support needs, right? So we have all that, but then layer on top of that even. Oftentimes autistic people have co-diagnoses. So they might also have attention deficit disorder. They might have OCD. They might have depression. They might have anxiety. They may even have non-mental issues like gastrointestinal issues. They may have difficulty sleeping through the night, a whole range of things. Then layer that even on top of the fact that autism is a lifelong condition. So the needs of an autistic toddler are going to be different than the needs of an autistic child, which are going to be different than the needs of a teenager or an adult. So the needs of that child are going to change throughout their lifetime. And so as we kind of take all these factors into consideration, I think it becomes pretty obvious then that understanding autism is an informational intensive process. It's a knowledge challenge as much as anything else. And given that it is such a knowledge challenge, what happens when that challenge is not met? To kind of break down these topics, I've broken down challenges by age group. This is by no means a definitive list, as I'm sure everyone in the room could probably point to, but I'm trying to kind of convey an idea here. So when we look at toddlers, well, we have people who are little people who are at an age when they can first be diagnosed, right? So the ability to detect those toddlers is going to depend on a couple things. Do their care providers, do their caregivers have a good understanding of developmental milestones and why testing those is important or monitoring those is important? Does their family physician have a sophisticated understanding of autism? Do they think autism just looks like a 4-year-old boy who doesn't make eye contact or respond to his name? Or do they understand that there is more variability in the spectrum? Does the caregiver know that autism assessments do need to be done regularly? On the physician's end or healthcare provider's end, do they have an understanding of the referral process for autism? A lot of families I know kind of have to go it alone. Is the physician able to take part in that process? If the physician's preferred person to refer to changes their insurance, retires, etc., do they have a plan B? Where else could they send them? All of those are knowledge challenges. Similarly, as the toddler becomes a child, now they have a little more freedom in the world. They're starting school, and that opens a whole new can of worms. Suddenly we have laws that dictate how the child is meant to receive education. If you don't know what those laws are, how do you know the child is getting the education that they are meant to have? What do you do if they're not getting the education they need to have? Who do you talk to about that? If you live in a community that has low autism knowledgeability, awareness, and your child is prone to, say, meltdowns, what do people think about you and your family? Are they tolerant of your child? Do they understand you? Or are you more likely to face some kind of stigma as you move through community? Do they look at you differently? Do they look at your family differently? Another knowledge problem. These continue into the teenage years as children move through the school system and they become teenagers. Now we have laws that support their transition into adulthood. Do you know what those are? Can you insist that they are being adhered to with your school district? Do you have a good idea of how to talk to your school district even? These are all kind of questions that add up. Also, teenagers, just like anybody else, autistic teenagers, start to experience hormones. So that suddenly we have urges we didn't have before. And we may need to talk to our child about sexuality, consent, dating. Is that a conversation everybody's comfortable having? Not necessarily even for typically developing kids, but we need to check that box. We need to do that. Now we have adults. So we're trying to figure out where the adult is going to fit into the world. Are they able to attend post-secondary education? Are they able to hold down a job? How do you make that decision? Where do you go? Are there places that help the autistic person find a job? If they do get a job, does the employer understand autism? Are they going to make assumptions about what your child or now grown adult can or cannot do? And I'm not asking you all these questions just to stress you out, although there were a lot of them. I bring it all up because, we're trying to the point we're making is that in order to provide autistic people with the best environment possible, a lot of people in the community need to understand autism. It's not just the caregivers, it's also community members, it's physicians, even the autistic people themselves. It helps them to understand kind of why they engage in some of the behaviors that they do as they get older. All right. So what happens when we are in a knowledge-sparse environment? And where are these environments? Well, they're kind of where you think they are. They're going to be, I don't think really anywhere in the state is super great in terms of autism literacy, but rural and medically underserved areas are especially affected. And why is that? There are a couple of reasons. First, there are just fewer healthcare providers in rural and underserved areas. That means there are fewer people able to talk about autism to the community at large. Also, while there are a lot of national organizations that focus on autism awareness, a lot of those, at least over the last couple decades, have really put most of their effort into cities, which kind of leaves rural people to figure it out for themselves. There's also fewer educational opportunities for physicians in rural areas. Kind of the rise of virtual education has helped with this, but there are a lot of CMEs that require in-person attendance. And if you are a rural doctor, upping sticks and driving to Atlanta maybe isn't the best thing for you. Lastly, there are, and I hate to say it, just lower educational levels in rural areas. I don't mean that in a judgy way, it just is what it is, and that does impact people's ability to take on healthcare information sometimes. All right, so all of these things combine to create a few unique challenges related to autism in rural places. So if physicians have a dated understanding of autism, or if clients or patients are less able to come to appointments consistently, that's going to impact how often developmental milestones are monitored or how they're monitored. It's going to impact autism screening. We're going to miss chances to detect autism. There also may be a hesitancy among physicians to diagnose young children. Some of this is, like I was saying, kind of a less sophisticated understanding of autism, but also if you don't know where you're going to send that child, is there a point in doing the screen? And that is the mindset of some people. Often research has found that often caregivers in rural areas feel that they're not really receiving the support that they would hope for from their physicians. They may not get information about autism following a diagnosis, or they may lack help with, or they may not get the help with referrals that they would hope for. All right. And then kind of as mentioned, there is that social stigma. If people around me don't know what autism is and suddenly I'm telling them my child's autistic, is that something that I want my child to carry? Do I want them to have that label? All right. This is all very relevant in Georgia because 120 of Georgia's 159 counties are rural. 141 of those are medically underserved. So a lot of these topics do hit rather hard. All right, so what's Mercer trying to do about this? Well, our modest effort. My colleagues and I received a grant through the NIH a little while ago to improve autism literacy in Georgia. So Glenda grants on this Glenda Grant has been helping us with this grant, and I think you've probably seen her around. Also tomorrow you might see my colleague Anna Krampel, so if you see her, say hi. But we received a grant to improve autism literacy throughout the state. To do that, we made a couple of things. We have some physician education options that has since evolved into a Project Echo. We also created the Autism Toolkit, which is a website I'm going to show you now. The goals of the Autism Toolkit, just as a little prep, we kind of think of it as having three main goals. You can access the toolkit using that QR code or using the web address. Our goals are to improve autism knowledge for people living in rural areas. And to do that, we write informational articles in response to user feedback that we receive. So if someone has a question about autism, we do our best to write an answer that will help them. All of our information is scientifically vetted. We also vet it with experts on the topics that we're writing about. So if we're talking about, say, any kind of behavioral topic, we might run it by an ABA or a BCBA or RBT. If we're talking about a neuroscience topic, I might be talking to myself like a crazy person or talk to a neuroscience colleague. If we're talking about medications, we have a psychiatrist we talk to. We also have law firms that do disability advocacy work who review some of our legal topics. So hopefully everything is, accurate. So that's one aspect of the toolkit. The other is helping people find resources. So one of the big issues is, I have this treatment that my child needs or that I need, and I don't know where to go. We created a map, which I will show you in a minute, to help people find resources in their area, or maybe connect them with resources that they don't know are there. We also have a event calendar, the thinking being that a lot of times, the world can become small for people contending with autism, and we do want them to have some options for building community, be that in person within their home communities or virtually. All right, so the Autism Toolkit, let's see if this works. So homepage, cool. As I was saying, we do sort our information by different categories just so you're not, searching through an endless pile. To see that, you can scroll down to Guided by Feedback. So if you're a person with autism, if you are a loved one to someone with autism, if you're a community stakeholder, meaning if you're a teacher, a coach, a grandparent maybe, these are all things that might help you. So if we click on, let's say, loved ones, we'll come to a secondary homepage where we have information curated to living with somebody who has autism, right? And you can see a couple of the articles coming up. We talk about early points, so if that's something of interest that Dr. Call was talking about earlier. Ultra-processed food, why won't my autistic child eat? Well, read our ultra-processed food article and find out. All right, so we have all that. If we just kind of want to see all the articles in their full glory, just go to resources, and you can see the whole list. It's some fun reading for you. All right. The other place where we have information is on our daily living tab, which is right there. And these are informational articles that we put together as kind of references, something that people would probably come back to again and again. And so we don't want them to have to dig through our pile in order to find them. So these are going to be things like, a medication cheat sheet. My child's medication has been changed. Tell me about that drug, right? We also have services for adults and for children listed out by county. So yeah, I hear some oohs. Yeah. So if we click on that, the phone book, and you can kind of see where your home county is and who's in your area, be it in person or virtually, so that you can contact them and hopefully find the services that you need. Same kind of thing for the adult services phone book. All right, so that's the information that we have available. If we go back to the home page, we also have a directory. And so, as I had mentioned previously, one of the challenges is finding service providers in your area. And we try to create our directory holistically. So we want So autism directory. So we have things like places that do diagnosis, places that provide early intervention services, but we also try to do things like list, dentists who can work with people who have sensory processing issues, try to list out places that help with transitional skills. We do our best to help list out places that can help adults find employment if that's something that they would be interested in doing. So we really try to cover the whole lifespan. The directory, the reason I have gray hairs, or any gray hairs that I do have, are because of it. All of these little pins represent a resource, right? And so if we click on a pin, we see resources pop up. And you can then click on the drop down, see what they do, see where they are, and to the best of our ability, we also list out what insurances they accept. Yeah. So like so. Babies Can't Wait offices are included. And the idea being that you can kind of go to find where you live on a map, zoom in, and see what's nearby. You can also sort the directory, if we scroll up here, by category. So if you're particularly interested in, let's say, I don't know, job skills training, click on the box, scroll down, and search. And you see things pop up that can help with job skills, right? So hopefully this does help people connect with resources. The reason it may or may not be giving me gray hair, we try to update this at least once a year, so everything is at least current-ish, okay? All right. If anybody is a service provider and they don't see themselves on the map, please feel free to contact me. We are happy to add people. And if you scroll down on the website, at the end of each page, we have a contact us box. We're happy to have you use it. We love to hear from our users. If there's something that needs to be added, if you have a question about autism, if you have an idea for an article, we're happy to hear all of it. The last thing I want to show you on the website, let's go back to the homepage, is our events calendar. So the events calendar is meant to, as I said, kind of help people find community, find connections, help them hopefully not feel alone, or learn from other people who have gone through the same sort of thing. So for this, the events calendar is going to be under resources. So little drop down, click on that, and you can see our calendar for July so far. So we add information to this based on kind of a list of people who do autism events that we follow. So kind of each month we'll go through the list, find if anything's happening, and add it to our page. For each event, let's find a fun one. Splash Night. Well, you can mouse over, see the information, and see the website, see where to sign up for it, anything like that. Okay. Another nice feature of the calendar is that, come on, little mouse, you can search by region or by type of event. So if you are looking for, in-person events in your home region, you can scroll down, select your region. So I live in Chatham County, which is in Region 4. Yeah. Go Savannah Bananas. And find events. And so give that a moment, and then you can see things happening in the Savannah area, right? You can also do, if you didn't see it before, virtual events. So if a virtual option is better for you, we have quite a few of those. Click on that. Yeah, all the virtual events that we are telling people about. Last point. If you do want to submit an event, there's kind of two ways you can go about it. If your organization is hosting like a spaghetti night or a run or something like that, you can submit an event here where you would just click on that, enter information about your event, and submit, and you'll get posted to the calendar. Or if you prefer, you can use the contact us, and we're happy to post it to the events calendar for you. So hopefully, Autism Toolkit is something that you all would find helpful, and you're certainly welcome, as I said, to interact with us and talk to us as you go. All right. So we do have a few plans for the website in the future, so please be on the lookout for them. We're going to add some location pages. So these are going to be pages that highlight certain locations in Georgia, like Albany, Valdosta, Bainbridge, places like that, where we're just going to list out kind of every autism resource across the lifespan that we can find. Give people good options if you live in that area. We're also doing some nice high-quality Spanish translations of our material. We had a Google Translate, which, it's okay, it was Google Translate. But I think we were kind of losing some people with that, so we hired actual Spanish speakers to write that all out for us. We actually have the translations. I just need to stop being lazy and put them on the website. We have new articles coming. I've kind of listed out a few of what's on the horizon, but those should be up within the next week or two. We also have Early Point signups. So Dr. Call had talked about the Early Point projects that we have running in different Georgia counties, places to sign up for it on the website. And then we're also going to put the results of another project we're working on that maps early intervention availability in different counties. Probably not something that's going to be terribly surprising to anybody, but if you were curious, kind of how does my county stack up to others, well, we're going to have that information for you. Lastly, if you do want to track these articles, we do have a Facebook page, and we are on Instagram, Autism Toolkit of Georgia. And we do announce new articles there. Otherwise, you can just check the toolkit to stay current. So with that in mind, does anybody have any questions? All right.
Comment. This is so helpful.
Oh, I'm glad. I'm really glad. Thank you.